Hi, welcome to week 8, part 2. We're going to talk about nursing as a healthcare profession. This is going to be fairly short, so go ahead and clap your hands with me. That's not going to take 15 minutes like usual. So the learning objectives are listed here, and we are described the education, training, certification, licensure, and roles of nurses, advanced practice nurses, LPN, MAs, and medication aides. So we're going to talk about nurses. I have a lot of friends who are nurses, and they are wonderful professional people, very dedicated to what they do. And the one thing that always struck me about a nurse is that they would say, you tell anybody a nurse and they'll immediately tell you their health history and start taking off their clothes so that you can give them an assessment. You know, I think that was kind of a joke, but nurses are highly respected. To be a nurse in our current society, you do have to go to school, and you can get a diploma, an associate degree, a bachelor's of science, or they do have bridge programs like an RN to BSN. So for example, if you were a nursing student at NICC and graduated with an associate degree in nursing, you can be in a bridge program. We have partnerships with Iowa and Upper Iowa University for RN to BSN roles. Nursing also has to have clinical training, and that's part of their educational process. And also hospitals have additional training that nurses can do at an entry level to help them progress in their profession. Certification, no required certification. There's a lot of specialty certification going on, but a nurse does need to be licensed. And they need to be licensed in the state in which they practice. And to get licensed, once they complete nursing school, they have to take an NCLEX RN exam and pass their board exams. The role of a nurse varies, but usually they're involved in direct patient care, which means continuous observation and monitoring of the patients in their care. They can do diagnostic testing, they can administer medications, they provide patient education and emotional support. There are different roles of nursing depending on where they are employed. So for example, if you're a hospital medical surgical nurse, you can get a certification that is a medical surgical nurse specialty, and then you care for patients within that area. You can also get a specialization as a nurse. So maybe you want to get specialized and do diabetic nursing care or rehabilitation nursing care, neurosurgery unit. Once you're in the profession, you can look for different specialties. And to do those specialties, you look for continuing education and you get certified. One role of a nursing is called advanced practice nursing, or an APN. And this is a nurse practitioner. And to be a nurse practitioner, that is above the role of an RN. You usually get a master's degree in nursing with specific clinical and diagnostic training. And the training programs include training in clinical setting for physical diagnosis, managing acute and chronic disease, well care, and prescribing. Now, the interesting part about a nurse practitioner is that as a nurse practitioner, you do have to be licensed, varying upon your state, but they will serve as a primary care provider extender. So they assist the primary care physician, and they can work in preventative medicine, acute and chronic care. So if you think about it, when you have areas of the country where you have a primary care physician shortage, the nurse practitioner can help relieve the workload of that primary care physician. And many times, they're just as respected as a primary care. If it is beyond their scope of practice, then they will refer to the primary care physician. You have a nurse midwife. Nurse midwives, when they graduate from their school, they can get into a postgraduate or graduate degree program. They have to have a bachelor's to become a certified nurse midwife. So what a certified nurse midwife does, they take advanced courses in all matters of childbirth, and that's antepartum, interpartum, and postpartum. Now for midterm, Antepartum is the care before a baby is born. Intrapartum is while the baby is being born. Postpartum care is after the baby is being born. The issue about nurse midwives and some of the obstacles that they've encountered is that sometimes the insurance, the malpractice insurance for a nurse midwife can be quite high. So not all areas of the country embrace them openly, but when they do get a practice, they're usually fairly busy. My daughter-in-law, for example, 3 of her children were born at home, and at each one of those births, she actually employed a nurse midwife to help with the deliveries. You can be licensed as a nurse midwife in all 50 states and the District of Columbia, and they also provide routine gynecological services, prenatal, delivery, and postnatal care. Another role that nursing can get into is called a nurse anesthetist. To be that, you have to have a bachelor's of science in nursing, and then you go to school for specialized training to be a CRNA, which is a certified registered nurse anesthetist, which is comparable to a master's degree. What a certified registered nurse anesthetist does is actually work in surgery and administer anesthetics to a patient. So their clinicals involve courses in simulation labs and practicum. Very well paid, very advanced degree nursing practice. Certification to practice, they have to pass a national certification exam, and they have to do continuing education every 2 years to renew their license, and they are licensed by the State Board of Nursing. But they provide a great amount of anesthesia care in the USA and usually practice with physicians, but they can be autonomous. Now, if you think about it, this is another role that's called a physician extender, because an anesthesiologist is a physician. So a CRNA is a nurse extender, and they help pick up some of the duties that was required of an anesthesiologist, but they practice in their role. NICC has a number of nursing students who have graduated, who have gone on to get their CRNA. Other nursing roles are long-term care. That is similar to general nursing, but they look at patients who require constant care and assistance. So you might find nursing in a long-term care facility. You'll usually have a director of nursing, and you will have RNs and LPNs and other nursing roles. Home health care. Home health care, one thing that has really changed over the years is that you can get infusion therapy, and that is administered by a nurse. They also, and this is a typo, I'm sorry, they do wound management and other care in the home. Wound management is big. A person can be in the hospital, they can stay home and get a nurse to come in and help take care of that. That would be better. And then community health nursing, that is when they work with the population as a whole, and they work at health promotion and disease prevention. Nurses can also be non-clinical. A lot of nurses, once they outgrow the role, I don't want to say outgrow, but maybe at some point in their career they don't want to be a floor nurse in a hospital and they want to do something different. They can work in administration, they can work in research, they can be nurse educators and work in a school such as NICC to provide nursing education, or they can be case managers. LPN is a different role of nurses. An LPN is 1 degree lower than a registered nurse. To be an LPN, you usually go to school for 12 to 18 months. And you get classes in med-term, anatomy, physiology, pharm, and practical clinical nursing courses. You do have to be licensed to be an LPN, and you do have to take a test. The difference between an LPN and an RN is their scope of practice and what they can and cannot do. So a licensed practical nurse, different from an RN, they usually provide more direct patient care because they have a little bit less scope of practice than the RN, and they usually work under the supervision of a registered nurse or physician. Most states vary, the laws vary, but most states will allow an LPN to start and administer IV therapy, and some will allow IV medications except a push. And IV medications are pretty touchy, so your state laws will vary. A medical assistant, and NICC has programs of medical assistants. They have different kinds of education. You can get a 1-year certificate or a 2-year associate degree. And those are some of the courses listed there that they take. You don't have to be licensed to be a medical assistant, but usually they're the people that do routine administrative and clinical duties, and they're usually employed in the ambulatory setting. So they're the person, as a patient, you walk in, they check your height, they check your weight, they take your blood pressure, they take your temperature, they get that basic routine information down, and then while you're waiting to see your physician. The role of the medical assistant is to get that information, plus it frees up your more advanced staff for other duties. A medication assistant is also called a med aid. Hours of training range from 15 to 70 contact hours. In Iowa, I believe a medication assistant is 80 hours of training, and you have to be certified as a nurse aide before you can do the med aid course. Most states will require an exam, and you need to be supervised in the administration of medication for a period of time. Most states license medication assistants. The roles vary, but usually what they do, a med aid, they can give oral medications, topical medications, nebulizer treatments, metered inhaler treatments, but they don't give beyond that. They are also considered a nurse extender. So in summary, nurses carry a big role, and as an HIM professional, you will be working with nurses, and a nurse is your ally. They are trained in patient assessment, and they're very good at it. You are trained in many facets of the health record. For example, many nurses never take a medical terminology course. You know medical terminology. Excuse me. You can read things that a nurse can't, and you can help explain that. You will learn about coding and reimbursement processes, which a nurse does not know. So as a way, you complement each other. But nursings are vital to the delivery of our health care, and there's many different career choices in nursing. We have had HIM professionals who decide after a period of time, hey, I want to be a nurse. Excuse me, which is fine. But just remember, you have a solid foundation. It is often said that an HIM professional knows everything that a nurse knows. We just don't practice it. I don't buy that 100% because we don't get the level of medical surgical training that a nurse does, but we know as much about healthcare delivery, the legal aspects, patient privacy and security, much more than a nurse ever will know, and that's our specialization. Okay, so that's it for this week. Review your PowerPoints, read your transcripts for week 8. Next week we're going to go into week 9, which is allied health professionals and the HIM profession. So have a good week, and we will see you soon.